That's why we have 3 other options of moisture control. Because there are conditions of the mouth that we cannot use dental dam.
Yeah.
So if we cannot use dental dam, we either use saliva ejector, we either use cotton roll or the dry angle. So what are the contraindications of dental dam? When can we not use dental dam? If I don't want to. Huh? If I don't want to. What are the situations? One is if the working tooth is the wisdom tooth or the last tooth, you cannot work unless it's a root canal, right? Root canal usually now for whatever always use a dental dam because your working tooth is your clamp tooth. But if it's a restoration and your working tooth is the wisdom tooth, there's no tooth behind it.
Yeah.
So where can you clamp? Nothing, right? So you cannot use a dam. What else? What other condition of the mouth you cannot use a dam?
One better is inflammation.
Gingivitis.
Gingivitis.
The more that you have to put the dam, so the gingiva is not exposed. But you cannot clamp the tooth.
Yeah.
If you're saying, okay, the rest of the teeth have gingivitis, then that's okay because the more that you just have to be careful putting it in, right? It's okay because the more that you have to cover the gingiva you're working so they're not gonna get sensitive. Other reason is if the teeth has lots of plaque, like tartar.
Yeah.
It's covered with tartar. You cannot put this because you cannot put this in between because it's covered with tartar. What else? If there's lots of missing teeth, because there's no way to stabilize it. If the whole teeth is missing, how can you? There's no way to stabilize the dam on the other side. Unless it's root canal, as I said, because only one tooth, right? You're gonna need. What else? If it's too difficult, like some people, I'm gonna breathe all these complaints, right? And then that's now the discretion of the dentist. Then you're gonna put it down. So you're gonna just put it down because you wanted to. You have to assess the patient's mouth and the situation of the mouth if you can put it down. But this is the best way to isolate and keep the moisture controlled. Even if sealant, if you do with kids, they prefer this because kids move their mouth a lot and they put their tongue. So you cannot control the saliva. So they put this one to make it sure that it's dry. So, but as I said, kids also, that's why they put gas, laughing gas, so that the patient is okay. Because if they put this in the patient's mouth, especially kids, they're like, I cannot breathe. Oh, I cannot breathe. That's it.
So, how about if you got